Here's a list of the imaging findings that we'll be going through. We have a list here. Some of them are highlighted in orange. Those will be the more common findings that you'll see and that you'll look for in IIH imaging. So just keep that in mind. The third one here, the transverse sigmoid sinus junction stenosis, has been found to be the most sensitive and specific for IIH. A close second will end up being the empty sella, which studies have shown to be in up to 80% of patients, 70 to 80% of patients. And as well as orbital findings that we'll go through. We have the flattening of the posterior globes that we'll see, intraocular protrusion of the optic nerve heads, optic nerve head enhancement, which can also come with some diffusion restriction, and optic nerve sheath dilatation, which can also be very tortuous. So those have varying degrees of frequency that you can see on imaging in patients with IIH, upwards of up to about 50%, some of them a little bit lower. And finally, we have these white colored findings that will also go through some of them, but those are less common. They can definitely be seen. So things that you want to keep in mind when you're looking at imaging. Those are prominent skull-base arachnoid granulations, and they have certain related complications that we'll go through. Cerebellar tonsillar herniation, as well as slit-like ventricles, which are a somewhat less reliable sign of IIH, but something you can sometimes see, specifically slit-like lateral ventricles.